Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover the Copenhagen Adduction protocol. There are 6 levels in this protocol. The first 5 levels are isometric exercises. The 6th level is a partner-assisted eccentric and concentric exercise. In the first phase, what we're doing is the patient is sidelined and they have their lower leg and knee resting on a bench or on a table. You want to have them start a little bit lower than hip height. What you want to do is you're basically in a side plank position with this forearm. You want the shoulder to be directly over the elbow. You want the forearm to be in a position where the thumb is up and the forearm is contacting the floor. The first step is have the patient be in a position where their spine is straight and their neck is straight. Place the upper hand on the hips and raise the hip as high as they can and hold an isometric contraction for 2 to 6 seconds. Start with a 2-second hold and build to a 6-second hold. Now in level 1, as you can see, the lower leg is staying on the floor for support. So then when we go to level 2, we're going to raise the pelvis and then we are going to lift the lower leg. Now one thing I didn't explain is this exercise is actually working the upper leg. It is strengthening the adductor muscles in the thigh. The adductor muscles are the muscles that bring the leg closer to the opposite leg or towards the opposite side. So again, in level 2, you want to make sure that the knee and the lower leg is on a table or bench. You're in a good side plank position. The hand or the upper arm is going to be on the hips, and you're going to raise the pelvis off the floor as high as you can, and then bring the lower leg off the floor. And this is an isometric contraction. You want to hold between 2 and 6 seconds. Start with 2 seconds and build to 6 seconds. So this is level 2, and then when you're done, you bring the leg down slowly. You control the eccentric phase, and then you bring the pelvis down slowly and control the eccentric phase. So the adductor muscles are working isometrically, and they are working when you are lowering the leg. They are supporting the entire body. That's why you want to work slowly or move slowly when you're lowering the pelvis and lowering the leg. In level 3 of the Copenhagen Adduction protocol, the foot is on the bench. Instead of having the knee and the lower leg, we have moved outwards and we have the foot resting on the bench. This is going to obviously make the exercise more difficult. You want to be in the same starting position, and in phase 3, or I should say level 3, you raise the pelvis as high as you possibly can, and you hold this position in isometric contraction for 2 to 6 seconds, and then you slowly lower the pelvis. Phase 4 of the Copenhagen Adduction protocol is a combination of phase 2 and phase 3. In phase 3, we had the foot resting on the bench, and that's how it's going to stay when we're doing level 4. But in phase 2, we raised the pelvis and the lower leg. So that's what we're going to do in level 4. So you want to get into the proper position. Going to raise the pelvis and then raise the lower leg and hold an isometric contraction for 2 to 6 seconds, and then slowly lower the leg and slowly lower the pelvis. Now in level 5, it is the same thing that we just did, but the bench or the table is higher. You want to have it at hip height. Now this one, the table is kind of high, so I was doing phases 1 through 4 at hip height. But you want to start with it a little bit lower, and then when you get to level 5, that's when you want to have where you position your lower leg or your foot you want to have that at hip height. Then, like I said, in level 6, that is when you are using a partner. The Copenhagen Adduction protocol is excellent for helping to strengthen the medial thigh muscles. Okay, medial means closer to the center, so the inner thigh muscles. These muscles adduct the thigh. They bring the thigh closer to the center or towards the opposite side. This is an excellent exercise for injury prevention and for injury rehabilitation. Obviously, you want to start at the level that works for you. I always recommend with this protocol that people start at level 1 and you build up to obviously level 5 and level 6. This is a very important exercise for athletes who may suffer from injuries to that area. Athletes who change direction very quickly. We speak about football players, hockey players, soccer players, lacrosse, field hockey, sports of that nature where athletes are changing direction, or what we call cutting, very quickly. So this is going to help to strengthen those muscles. It's a very good preventative exercise because you're using the isometric, where you're holding the contraction, you're building strength, and you're building endurance. And then also it is a good rehab exercise. Thank you everyone for viewing today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. You could go to my website, Championship Chiropractic, to learn more about the book, and also you can watch some of my videos and see my blog on my website. Again, my website is championshipchiropractic.com. Please feel free to like this video. If you have suggestions, feedback, or questions, please leave them in the comment section below. Please subscribe to my YouTube page. My YouTube page is Dr. Donald A. Ozello, DC. If you are watching this video, you are on my YouTube page, so please feel free to subscribe. Always remember, train hard, train smart, get adequate rest between training sessions and competitions, utilize nutritional and supplementation strategies that work for you, stay injury-free, and accomplish your goals. Thank you. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.